right, I want to thank you for joining me today. Again, my name is Kendra Sanders. I'm with Curves, and I will be leading you on this info session for relieving neck and shoulder pain with foam rolling. I love these sessions because they are really interactive. So I want to get started with a few questions for you. Would your daily activities, your daily living, the things that you do every day be easier if you had greater range of motion in your shoulders? Would it be easier? And what about if you were able to turn your head with greater ease? Let me tell you about two things that I think as we get older become more difficult. Things where you have to reach behind you. Putting on your undergarments might be a little challenging if you've got a limited range of motion in your shoulders, or maybe reaching overhead. Or think about driving the car that you need to turn your head, in fact, your entire body, but there's a lot of head turning when you look behind you when you're backing up your vehicle. Well, if you answered yes to either of those questions, you are in the right place. Let's take a peek at what we can do to help relieve that pain. Any woman who regularly engages in the Curves circuit, the Curves 30-minute workout, or any other strength-focused full body workout, knows that exercise comes with occasional soreness and muscle pain. And sometimes that soreness comes from the muscle damage, quote unquote, from a tough workout that causes muscles to grow stronger and more toned. Other times, it's from a strain or an injury. Either way, if the pain is in your neck and shoulders, it's impossible to ignore. Each time you move your arms or your head, you are reminded of the discomfort. The good news is that you don't have to spend tons of money and time on professional massages for your shoulder or neck pain. Once you have the green light from your doctor, you can use effective foam rolling exercises to relieve neck and shoulder pain. So what's a foam roller anyway? Well, a foam roller is a cylinder made from solid foam that comes in assorted sizes and levels of firmness. And by placing the foam roller under your body and moving in particular ways, stress, tension, and pain can be relieved through a technique called self-myofascial release, SMR. Foam rolling works to relieve muscle pain by increasing blood flow to the muscles, right? Makes sense. Let's get some circulation going there. And by breaking up knots or trigger points. People use foam rollers for a variety of reasons. Some might roll out their muscles to loosen them up before a full body workout. Others use foam rollers post-workout to prevent soreness. And foam rollers can also be used to get rid of muscle tension, either post-workout or whenever it may strike. Studies have shown that foam rolling has merit. One study found that people who used foam rollers for 3 days in a row, had less muscle fatigue and better range of motion. So it seems foam rolling benefits accumulate over time. Over the past several years, a number of research studies have been completed highlighting the benefits of foam rolling. These benefits include decreased soreness and fatigue following a workout, improved muscle function and range of motion, improved artery flexibility. Did you ever think about how your arteries, your circulation system needs to be flexible too, right? That can help lower blood pressure because the body is able to push blood through the body with greater ease. In short, foam rolling can be like hitting the reboot button on your body. As with every new exercise program, it's always best to consult your primary care provider first, especially if you have chronic pain or a major injury. With all the benefits to foam rolling, it's hard to believe that there may be reasons to not foam roll. But Some of the reasons may include, but they're not limited to, osteoporosis, foam rolling, pardon me, foam rolling on the spine and or hips should be avoided. Diabetes. If you have neuropathy, this is particularly important. Foam rolling may cause damage to the blood vessels that you cannot feel. High blood pressure. Foam rolling, when done correctly, can be uncomfortable, and discomfort can cause you to hold your breath. Have you ever experienced that? You're doing something strenuous or uncomfortable, and you hold your breath while you're doing it, and that can elevate your blood pressure. Varicose veins. Foam rolling over varicose veins can cause more damage to the vein as well as increased discomfort. Any area where you have had a recent injury or surgery should be avoided, as well as any area that has swelling. And pregnancy. During the third trimester, your body starts to produce the hormone relaxin, which helps relax the muscles around the hips in preparation for giving birth. This can also cause joint instability or joint stability in the hips to decrease. Foam rolling may increase this instability. Pregnant women should also avoid foam rolling their lower legs, ankles, or feet, as this can induce labor. As I mentioned before, foam rolling and other forms of myofascial release can cause discomfort, much like a deep tissue massage. On a scale of 1 to 10, 1 being you feel nothing and 10 being extreme pain, foam rolling should be somewhere between a 6 and an 8. This is why we say it hurts so good. It hurts so good. If you are doing it correctly, it will be uncomfortable in the moment, but it will feel good later. It's important to note the difference between discomfort and pain. And if you're ever feeling pain, please consult your primary care provider. So let's give some of these a try. If you have a foam roller, fantastic. If you don't, you can still attempt these exercises without a foam roller so you get the feel of how your body may move. So let's start with a standing neck stretch. This is going to work on your neck mobility. So go ahead, let's get up and do this. Start by standing with your feet hip distance apart. Engage your core. That means you're supporting your abdomen and putting your pelvis into a neutral spine. Your shoulders and hips should be level, not with one up or one down. Inhale, and as you exhale, slowly lower your right ear toward your right shoulder. Exhale and lower your right ear toward your right shoulder. Now let's hold that for 15 seconds. I'm going to count it down. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. If you would care to, on the next round, when you step away from this info session, try that again and try holding it for 20 seconds. Now, inhale and return to center. You should now be in the neutral position. Now let's try it on the left side. Exhale and lower your left ear toward your left shoulder. Now, it doesn't have to touch, but you do want to get that movement of the ear coming down toward the shoulder. Try not to raise your shoulder to meet your ear, because you want to feel the stretch through the right side of your neck from behind the ear down into your shoulder. All right, let's look at the next one. There we go. All right, let's try this stretch. Sit on the floor with your knees bent and your feet flat on the floor. You're going to place the foam roller behind you if you have one. If you don't have one, that's fine. You can do the same movements without the foam roller to get the idea of what the movements are. Now lean back so the foam roll so that the foam roller is in contact with each vertebrae. You want your back to be in contact with the foam roller. Now keep your chin tucked. You can even pretend that you're holding an egg under your chin close to your chest. Now, engage your core. That means support those muscles. You want to hold that core. You don't want a slouchy belly, right? Support your core. Lift your arms directly above your shoulders, reaching your hands toward the ceiling. This movement is going to separate your shoulder blades. Use controlled movements to lower your arms out to your sides. And you're going to form what I'm going to say is like a snow angel. Okay. You've probably seen that. Put your arms out to your side like you're making a snow angel. Now, perform 1 or 2 sets before or after your full body workout. Again, engaging the core. Lift your arms directly above your shoulders. Reach your hands toward the ceiling. That's going to separate your shoulder blades. There's a demonstration of it on the screen now. Watch as she lowers her arms to the sides as though she's working to make a snow angel. You'll notice it's a small movement, but she is breathing throughout this exercise. So don't hold your breath. You're going to hold this position and then lower your arms to the sides. All right. Good job if you did that. Let's try it one more time. Lean back. The foam roller should be aligned with your spine, vertebrae touching. Reach your arms to the ceiling. Now lower your arms down and bring them back up. You'll perform 2 sets of those before or after any of your workouts. Now, let's try our sides. We're going to foam roll the latissimus dorsi, or the lats. So lie on one side with the foam roller under your armpit. Use your forearms for support like you see on the screen. You're on your side, but your arm is supporting you in front and sort of over your head, but on the floor. Move on the foam roller along the length of the entire muscle. And you want to do this very slowly, only about 1 inch per second until you hit the most tender spot. You may notice that you have an area that is tender. If you do, hold the pressure on that spot for 30 or up to 90 seconds. Be sure to breathe. You want to make sure you're breathing throughout this exercise as you hold that pressure. And then you're going to repeat it on the opposite side. Now, if you're not comfortable on the floor or you have trouble supporting yourself, you can also do this exercise standing by placing the foam roller against the wall and using the wall as a place to align your body. And you will move that foam roller up and down. All right, we can watch that video. You see that she's moving very slowly, very, very slowly across the latissimus dorsi, the lats. It is a very slow, controlled movement. All right, there you have it. Let's try one more. Remember, if you find a spot that is particularly tender, you can hold there for at least 30 seconds, but up to 90 seconds. And be sure that you are breathing. Inhale and exhale. Sometimes it's good to inhale through your nose and exhale through your mouth. All right, let's move to the next one. Now let's try the prone position. Lie in the prone position and place the foam roller at the base of your pectoral muscle near your armpit. Right? It's sort of going to be in that groove to the right of your breast, there, just toward the armpit. Support yourself with your free hands and feet and slowly roll up and down the length of your pectoral muscle for 20 to 30 seconds. You'll adjust pressure on the roller by raising your hips higher or lower, or putting more force on your free hand on the ground. Remember, it is so important to breathe as you move through these exercises. You can also do this, as we did on the previous exercise, by standing and placing the foam roller against the wall. Let's take a look at this. You see, it's a movement that's moving across the body, not up and down the body. This is moving across the body. It's a very slow, even a very small, controlled movement. Hold if you feel tenderness, but be sure to keep breathing. All right, let's try one more. Very slow, controlled movement. Again, about 1 inch per second. And there you have it. Remember, on these exercises, whatever you do on the right, you're going to want to duplicate on the left. If you would like to learn more exercises to help relieve neck and shoulder pain, please check out My Curves on Demand. You'll want to look at the stretching and recovery class types. These classes are designed to help improve your muscle performance and mobility. And the great thing is that most of these classes are only 15 minutes, which is perfect when you want to move your body but are short on time. You can also check out one of the newest classes, Shoulder Mobility, which will incorporate stretches, foam rolling, and exercises to increase the shoulder range of motion and stability. So if you'd like to learn more, please talk to your curves coach, or you can go to www.mycurvesondemand.com. You'll see that website right at the top of your screen. I want to thank you so much for being here. And I want to remind you that if you are a Curbs member and you're interested in more information on My Curbs on Demand, please be sure to talk with your coach. That is also where you can order a foam roller. Thank you so much for being here. It is always great to talk with and share information with our Curbs fans. Thank you so much. Have a great rest of your day, and we look forward to hearing and talking with you again soon. Bye-bye.